Good afternoon, everyone. We're going to get started in just a few moments. We'll wait until everybody loads into the room. So everybody will be on mute for now.
I see Dr. Lofi is here. Okay.
Hello, can you hear me?
We can.
Great.
Thanks for joining us.
Hello and good afternoon, everyone, and welcome to today's COVID-19 check-in for Friday, May 22nd. Before we get started, I want to go over a few housekeeping items that most of you should be familiar with. Everyone was automatically muted coming into the webinar, so if you would like to ask a question or make a comment, you'll want to click on the raise your hand icon. That way it knows that you want to speak. It's on your control panel. As mentioned, everybody has been muted, so if you're dialing in by phone only, you can press *9. That alerts us that you want to be unmuted on your phone. If you are dialing in by phone separately, if you want to use the chat box, you can provide what your phone number is. That way we can assign your name to it as well. As mentioned, you can use the chat box if you would prefer to type a question or make a comment into the chat box, or we encourage you to also use the question and answer box as well, and we'll try to get to all those questions we can. On screen, everybody should see the COVID-19 check-in. If you're not seeing that, or if you have any issues for audio or visual, please use the chat box and let us know. We'll try to problem solve behind the screen. Otherwise, I'll go ahead and pass it off to Jamie Bodden.
Thanks, Jason. Much appreciated. And go ahead to move to the next slide. Just a reminder, this webinar is being recorded, and we've been able to post these onto the WASAC website. Typically, they're ready a couple of business days after our webinar. And so if you miss it or want to catch up on past webinars, they should be posted on our website. Go ahead and move to the next slide. Today we have a guest speaker from Department of Health. Dr. Lofi is going to update you all on some key things that have happened in the last week. A lot of things have been happening for public health and metrics and data over the week. So she'll give you an update on that. You'll also have a chance to answer or ask her questions. A reminder to use the chat box if you do have questions for her. And then with the remaining time, we will do a quick county roundtable led by Eric, and then just provide some quick reminders for you all as well, given the 3-day weekend and then a busy week next week for us all. So with that, Jason, let's move to the next slide. And we will turn it over to Dr. Lofi. Dr. Lofi is our state health officer. I think she's either been on this call with us before, or she has participated in the governor's weekend calls that we had early on in March with the governor and Secretary Weisman as well. And so Dr. Lofi works really closely with your local public health officers on coordinating a lot of state and local response. So Jason is going to share her screen and give her control so that she can give us the update. So with that, Dr. Lofi, feel free to take it away.
Thanks, Jamie, and good afternoon, everyone. And happy Friday. It says you cannot start share screen while the other participant is sharing. Oh, okay.
Okay, so go ahead and see if you can request to share screen now. There we go.
There we
Great.
go.
And you can see the document that says key metrics.
Yes.
Yep. All good.
Great. Well, good afternoon, everyone. This is Kathy Lofi, as Jamie said, and it's a pleasure to be with you here this afternoon. Before I talk about the metrics and the second step we took during the variance process, I just want to talk first on a bit of a high level about where we are in the pandemic. So as most of you probably know, we've seen a really nice decline in severe COVID-19 cases. And by severe COVID-19 cases, I mean deaths and hospitalizations. We've seen a really nice, downward trend in both of those indicators. Those are two of the most important indicators I look at because those are the people who are having the most severe outcomes, and those are the outcomes that we really want to minimize. You also have probably noticed that when you look at our overall cases, we peaked sometime at the end of March. We saw a decline, and then we had kind of a several-week plateau in our case counts, which I think was kind of frustrating to everyone. In the past week, it looks like maybe our total case counts may have come down a little. The data is never complete for the very last week, so we're still waiting. And then the last thing I just wanted to mention about the pandemic is that, as you guys know, disease activity is pretty heterogeneous in our state right now. And even within some counties, I just looked at some of the King County data yesterday on a sub-county level, and there's great variability sort of within the county around, what cities are having higher incidence of disease and lower incidence. And even in big rural counties, I'm hearing that, well, there's a little bit of disease in one city, but there's no disease in the city across the county. So these are kind of that heterogeneity has made our policy decisions, I think, difficult in a lot of ways. The other thing I just wanted to mention is that I know you're all very anxious to start reopening your economies. I am as well personally. I know how much a person's economic status contributes to their health and how important that is. And as a state, as we start to think about sort of reopening businesses, I just want to make sure that everyone fully understands the importance of the public health response in keeping the disease in check. If we are going to be successful with opening our businesses, we have to make sure that our public health response in every single county is incredibly robust. And that means everybody has access to testing. That means that we have a sufficient number of staff in our local health departments to do aggressive case and contact investigations. We can support individuals who are in isolation or quarantine with meeting their needs, getting them groceries or medications if they can't leave the house. And lastly, we have to be able to respond quickly and aggressively to outbreaks, either in workplace settings or long-term care facility outbreaks. And I know all your local health jurisdictions have been working really hard to beef up their capacity to do all these things. And just want to encourage you to support your local health jurisdictions so that they can be successful in having a really robust public health response, so that we can open, the economy and not see big rebounds in disease. So what I just talked about was sort of the framework for our reopening plan. As you guys are probably familiar, we talk about COVID activity overall. There are a number of different metrics we look at when we think about COVID activity. And then we look at readiness around the healthcare system, case and contact investigations, testing, and responding to outbreaks. So for a long time, we have a lot of data sources that we use to evaluate those 5 key aspects of our response. Actually, one is COVID activity, and then the 4 key aspects of our response. And one thing that's been really challenging, I think, for public health officials across the entire country is that nobody's really reopened an economy after shutting an economy down, essentially. No one's ever shut an economy down. As you know, all of these things that have happened over the past few months have been completely unprecedented. And every state is now trying to figure out, okay, well, what's the smartest way to reopen? And unfortunately, there's not a lot of data that tells us what the smartest way to reopen is. We have some experiences from other countries. We've gotten some minimal guidance, I'd say, from the Centers for Disease Control. And there was just an article in the Wall Street Journal yesterday, I think it was, or the Washington Post yesterday, about the metric states were using when thinking about reopening, and they're all different. And the reason is because nobody has actually done this before. So as we started thinking about these 5 key areas, we had a number of discussions within the public health system about, well, what are really our metrics? We know we look at all different types of data in these areas, but what are really our key metrics in each of these areas? And more difficultly, the more difficult decision is really trying to figure out what's the target for each of these metrics. And that's what's been really hard to sort of determine. So as a public health system over the last few weeks, after the last, I guess, 2 weeks, we put together what we consider our key metrics that we have kind of all agreed to in the public health system to use to guide our public health decision making. And when we came up with these metrics and we set these targets, we kind of agreed as, I think, a public health system that these targets really do represent the ideal state. We realized that many of these targets would be very difficult to reach, but we wanted to have something in mind, at least so that we would know where we're headed and what would sort of be the ideal state if we got there. These metrics were not really necessarily designed to be targets like, we did not necessarily think all these targets needed to be met in order to move to the next phase. And they don't necessarily mean that if you fall behind in one of the metrics, you will move to an earlier phase. They weren't really intended that way. They're really about, as a public health system, figuring out what's that ideal state we're really striving to get to and how close are we. And I really think that you really need to consider all these different areas together when you're thinking about your readiness to reopen. So I'll talk through them a little bit. So the very first metrics that were chosen were around COVID-19 activity. And the first metric was the incidence of new cases reported during the prior 2 weeks. And this target was set at less than 10 cases per 100,000 over a 2-week period. And the reason this metric was chosen is because CDC recently put out a guidance document to states around reopening. And in that guidance document for moving from phase to phase, one of their criteria was either a downward trajectory in case counts over a 2-week period or an incidence of less than 10 cases per 100,000 for the past 2 weeks. As we were looking at our numbers, we thought that, gosh, that seemed like about the right target for the next phase of, for the next group of counties that we would allow to apply for a variance. That does not necessarily mean that that will be the criteria for the next step that we take. It just happened to be the criteria that we thought felt right for allowing the second group of counties to apply for a variance. We also look at the reproductive rate, and that's essentially showing us how quickly the virus is spreading. We have Microsoft programming a dashboard so that we'll be able to see the reproductive rate by region throughout the state. We worked with our healthcare system to come up with some healthcare system readiness measures. We know that if hospitals have less than 80% of their licensed beds full, that's a pretty good place to be When they start getting over 90% of their beds full, we get a little bit nervous in terms of if we had a surge, if we had a big outbreak at a nursing home in the community, and 10 patients had to go to that hospital, would they be able to handle it? Healthcare systems have also told us that when more than 10% of their patients in their hospital are COVID patients, things get really busy because these patients can be pretty intensive to care for, just given all the precautions and the personal protective equipment that has to be worn. So they essentially told us, we like having less than 10% of our patients. When we get to over 20% of our patients in our hospital with COVID, that's when things get nervous. That's when we get kind of nervous and things get stressful in our hospitals. The next measure around testing was perhaps the most difficult one to determine. The two metrics are the average number of tests performed per day during the past week, or the average proportion of tests positive for COVID during the past week. And that target is around 2%. And the reason that where that comes from is that we think currently in the population, the prevalence of disease is probably around 2%. So if we're doing a lot of testing to the point where the prevalence of all of our tests are 2%, that's probably about the right place. We also know that it's really important for people to get diagnosed quickly so that they can go into isolation quickly. So the next target is really looking at that time from symptom onset to when the person actually gets their specimen collected. And we think ideally that should be 2 or less days. And if you have good access to testing in your community, once people get sick, they should be able to quickly get a test and then know if they need to be in isolation or not. So that's the thinking behind that testing one. For case and contact investigations, our ideal target in the public health system is to be able to reach and interview about 90% of our cases within 24 hours of receiving their positive lab report. And then to be able to interview those cases, talk to their contacts, and then be able to reach all of their contacts within about 48 hours of the lab result coming in. Again, timeliness is very important. If we don't contact cases until 9 days after their symptom onset, they've often been out in the community exposing people for 9 days. So we need to shorten that time to diagnosis, shorten the time to getting them in isolation to really minimize transmission. And then the last metric, the last area of our plan is really around, the last area, I guess I'd say, of the public health response is around making sure that we can protect high-risk populations and making sure that we're protecting high-risk populations. And so for this metric, we look at the number of outbreaks that are reported by week. And there's kind of some different thresholds. Like ideally, if you're a small county, ideally we'd like to have no outbreaks. For larger counties, we know that there's going to be ongoing transmission, and our goal at this point is really to keep that transmission to a minimum. So the next thing I was just going to really briefly show you. So as I mentioned, we decided to use that very first metric to be the criterion for allowing the next group of counties to apply for a variance. And our epidemiologist calculated what that rate would be for every single county. So the first column in this document are the total number of case counts over that 14-day period. And the 14-day period we used was between May 3rd and May 17th on this report that was run on the 20th. We know the last few days of data are not very complete, so we threw out the last few days. So Benton County had a total of 106 cases over that 2-week period. If you divide that by 14, their average daily case count is 7.6. So on average, they're getting 7.6 cases reported per day. If you divide that out by their population and multiply by 100,000, you get a rate of 3.8 cases per 100,000 population per day. And 10 cases per 100,000 population per 14 days is the same as 0.71 cases per 100,000 patients per day. So if you take those 10 days and divide by 14 days, you get 0.7. So then we looked to see all of the counties that had rates that were less than 0.7 and decided that that was probably, it felt like a good cutoff. It was 30% of our state. It felt like a good way to sort of decide who could be the next folks to move into phase 2. As I said, this is not, there's been no decisions as to what would be the criterion, for sort of the next step we want to take. We're in active conversations with the governor now about the stay-at-home order that ends on May 31st, and talking about, what that might look like. So with that, I'll stop. I think Jamie only wanted me to take about 15 minutes, and I've probably taken more, but I'm happy to answer any questions that people might have at this time.
Great, thank you, Dr. Lofi, and I think it's very informative, and I know I always appreciate kind of going through what the data means and what those metrics mean, and kind of the greater picture that we're all operating in. One question that's come up, and kind of I'll expand on it as well, is the governor has been using the R0 data as only relevant to King County. Do we have R0 regional data or county level data? And if you have that regional data, how is that defined? But then, kind of just the greater metric picture, are those metrics available at the county level?
Yes, so we actually are working with a Microsoft programming team, their data analytics team, and they're helping us program these metrics into a dashboard so that we can see for every county, how many tests they performed and how close they are to that given target. And it's not going to be a yes, they met it, or no, they didn't. I think it's more about, I personally like seeing the actual numbers. Like if you're close, that's great. Over as a state, we're at a 0.4 to 5% positivity. 0.2 is really low. I mean, that's really the ideal state. I'm much more interested in looking at the absolute values. So we do have this Microsoft team that's going to program in these metrics by county. And they're also calculating the R0 by county when possible. They need fairly robust data, so they can calculate an R0 in King and Pierce and Yakima right now, because Yakima has high case counts. And then they have to sort of form regions for the other regions of the state, just because fortunately case counts are lower in other regions of the state. So yes, we are trying to do that and calculate R0 on a more granular level.
Great, thank you. Quick question about the population data. What was that? Were you getting that data from OFM, and what year were you using?
Yeah, so we always use the OFM denominators and all of the calculations we do at the Department of Health. And the data we're using is their most recent population denominators, and I believe they're the 2019 data. I think they published their data in April of 2020, and it was for 2019.
Great. Would you be able to kind of describe, the governor has outlined, those phases, and we're in phase 1, except for our counties that have gotten the variants approved, and we have a number of counties moving forward. But underneath that, there's a lot of different activities that are identified in each of those phases. And could you kind of describe what kind of the rationale was used to kind of identify what sectors would be most appropriate in what phases?
Sure. So from the individual perspective, I mean, the first recommendation is that people do not really gather with more than 5 people outside of their household per week. We wanted to keep that really low, because when we do case investigations, we know that the people who are at highest risk of getting infected from a case are those people who live with the case And those people who have had close contact, which means like face-to-face contact with somebody, like in a conversation for like 15 minutes. And that's what you kind of do with your friends that you gather with. So we really wanted to keep that number low. In terms of the business sectors, there were a lot of different things to consider. We considered both the risk of transmission during the particular work setting. We also considered the importance of different work sectors to the economy. That was something else. We had some health equity, considerations. Considering we know that there are, a lot of lower wage workers who are out of work right now, and what, would help them. So I think that there were a number of different factors. There was no formula. It was, really thinking about these various factors and really thinking about what we think, what really was our expert opinion. And that's really what it was based on.
Great, thank you. We have another question that came in. Please confirm no more than 10 cases per 100,000 population over 14 days, not 10 cases or less per day.
Correct. It's 10 cases over the 14-day period. So if you are in a county with a population of around 100,000, you can only have 10 cases over a 14-day period. And just so that you guys are aware, there's been a lot of confusion over this. There's lots of different dates that you can use. We have a date that the person reported they first got sick. We have a date that their specimen was collected. We have a date that the report actually came into the Department of Health. We, for our calculation, are using the specimen collection date. So in this report, we looked at everybody with a specimen collection date between May 3rd and May 17th. And then we calculated, what the crude rate was per 100,000, per that 14-day period. It's complicated in this chart. We actually calculated the rate per 100,000 per day, but you can also calculate the rate per 100,000 per 2 weeks. So you're either looking at a cutoff of 10 cases if you look at it per 14 days, or you're looking for a cutoff of 0.71 case if you are calculating it per day. You guys will all be epidemiologists by the time this is finished.
For better or worse. Thank you. We're seeing a lot in different counties around masks, and just wondering if you had some thoughts that you would be willing to share around masks.
Yeah, so as this pandemic has evolved, I have become more and more a supporter of wearing masks in public. I don't go anywhere now. I don't go anywhere without a mask. I always wear it when I go to the supermarket. I have my teenage boys wear masks. I think it's incredible. I do think it's a very important part of this response. And I feel like since everyone is so hungry to get back to some normalcy in our lives and open, get our economy back in track, I feel like it's one thing that might help us get there. So I am a huge supporter of masks. We've had lots of discussions about this. And I really believe that we should really be encouraging a lot of our businesses to require them for people who are coming in. Coming into stores. One problem about writing public health orders is we don't have great enforcement mechanisms. But I would encourage you all to be leaders in your communities around mask use and be an example. It's not about you being protected. It's about you protecting other people. And I think that's the one thing that people don't always get. I think some people still kind of think, oh, I don't need one. I'm not worried about getting sick. But that's not what they're about. They're about you spreading the disease to other people. And I think it's really most respectful if we do, when we go into grocery stores, wear masks, because there's workers who have to work there. And it's, respectful for them for your face to be covered. So I'm a big fan of cloth face coverings.
Great. Another question that came in, and perhaps we'll end with this one, and I'll let Eric pose the last question. As always, I like to put him on the spot. One question is, we have some natural communities that cross county lines. There's some equity issues in allowing one part of that community to open and denying access to economic recovery to another part of that community because they're divided by a county line, and perhaps one county is able to do a variance and the other one is not. Any flexibility to allow municipalities to apply for variance given this issue?
I would have to discuss that with the governor's office. Is there a specific municipality in mind?
I'm sure Commissioner St. Clair would let us know. I know that exists in a lot of different parts around our state, so we'll probably have a lot of a lot of thoughts.
Yeah, that hasn't come up and that hasn't been discussed, but I can certainly bring it back, you know, to our team to see how they feel about that.
Yeah,
I know it's really hard in a community if like half the, yeah, no, I totally understand the difficulty around that.
Absolutely. And we have a comment too that we share a stoplight with Idaho. So you even have cross-state issues as well. So perhaps we can kind of gather some of that data for you to have that discussion with the governor on.
Yeah, and we were well aware of the Idaho issue. We had heard that from some of our counties that, particularly Asotin, you know, they're right across the, I think it's the river out there, you know, from Idaho and Lewiston and Clarkston. And it was, I knew it was particularly difficult for that community, but I believe that they are now applying for, or I think they maybe already have had granted a variance. So I know it's difficult across county and state lines as well.
Mm-hmm. In response to that community question, another one, Stanwood and Camino in Island County. And then a quick question, will DOH be able to provide guidance on wearing face masks just to help, given the political polarization, kind of helping to change some behavior? I don't know if you have any statements or anything on that.
We do. We have a statement that, you know, recommends face masks on our website. It's been there for a long time. And I believe it specifically says, you know, if you're out in public and you're going to be like within 6 feet of somebody else from the public, we strongly encourage people to use masks in those situations.
Yes. And do you have any messaging tools?
Oh, I don't think so. I'd have to check with our comms folks.
Okay. I know there's,
sure.
Yeah, and I know there's other counties that have passed that too. So perhaps that's something that WASAC can work on too, in coordinating other counties that have passed mask directives too and sharing that.
Great.
All right, we have another question coming in, lots of questions coming in now. We've woken them up. Appreciating the science and epidemiology, but anxious over politics winning out over science. How has there been much consideration given to the carrot versus stick? Since we have essentially no enforcement kind of as a public health tool, is there a better approach that's being considered as a strategy?
Is that specifically around masks or?
I think just in general, in the phases.
Oh, in the phases. Gosh, I'd have to think about that. If you have a specific example, whoever asked that question around exactly what they're thinking about, that would probably be helpful. And in general, we're really open to, you know, any advice that folks have about, you know, how to move forward. As you know, these are really difficult decisions. We don't want to be put in a place, you know, where we all of a sudden have a big rebound and have to go back to staying at home. That would not be a good outcome. So we're really, but really open to, what folks, feel is the right thing to do, particularly for the folks who are in the counties now that are still, that have not been given the opportunity to apply for a variance yet. We're actively talking about the May 31st, deadline. So would be interested in hearing thoughts from folks.
Great. Another question that's come in, curious about phase 2 reopening of offices in the private sector versus phase 3 public facing offices. Can you clarify this distinction, or is this something that we need to circle back with governor's office on?
I think the public facing was more like the governmental offices that, actually give services to the public versus an office environment where people like Microsoft, well, they can telework, but an office environment where people come together and don't have as much face-to-face interaction with the public.
Great. Thank you. Councilmember Hughes, just wanted to let you know, if you're looking for some Memorial Day weekend reading, San Juan County is submitting their variance.
Okay, great.
Another question, how will you determine when to move the dates used for COVID-19 activity criteria?
When to move the dates used for COVID-19 criteria?
I think that's probably relating to, you used, in this first round, you used the 2 weeks ending May 12th.
Yeah. I'm sorry, thank you for explaining that. So we're running this report. We've asked our EPIs to run it every day. And so every day, so if today is the 22nd, they'd probably go back like 3 or 4 days from today, just because our data lags a little bit, and then do, probably a report from the 5th through the 19th. So we are continuing to update this every day, and, those 2 weeks will continue to roll as we do the updated report.
Great, great. And a link in the chat box from Tacoma Pierce's blog around masks. So if you're curious about that, please click on the link and you'll see a blog post by Dr. Chen. Island County is going to add to the weekend workload. They've also submitted their variants, so great. I'm not seeing any additional questions come in. Eric, how about I turn it over to you and give you the final question?
Uh-oh, is this going to be a really hard one?
Really hard. No, it won't be. Actually, I thank you very much for joining us again, Dr. Lofi. It's really good. We appreciate it. Now, Mason County is saying they submitted their request, so you've got a lot of weekend work ahead of you. I think really one of the questions, if you could just talk about it, and this is the ongoing, I think, dynamic that our individual counties are now facing, which is this constant balance between protecting public health, but also being very cognizant of the socioeconomic impacts from the disease, and how do we open up the community in a safe way, and that tug and pull between the two. And King County Public Health actually produced a report that really started to talk about some of those other social impacts that are occurring because of COVID-19. And what guidance would you're clearly have a public health perspective, but what guidance can you give the commissioners and council members who are having to wrestle directly now in these variance plans about balancing the socioeconomic concerns and impacts in their community with protecting public health?
Well, I think it absolutely is a balance. And I think the community leaders need to figure out, like, what is that balance in your specific community? What is it that, you think really needs to open to really help on the economic side? And how can you do that in a really, really safe way so that we don't have to go backwards? And I'm hoping that we will at some point find this equilibrium where we can, maybe maintain this reproductive rate around 1. We're still going to have disease. It's not going away anytime soon. But we need to find that balance where we can have that reproductive rate at 1, but have, make things create a new normal that allows us to sort of, keep the virus suppressed so that we don't see outbreaks. I don't think I know the answer or have any other great advice, but I know you all know your communities best. And you know where people, I think, are, what would really help with the economic piece. Make sure that you give us that feedback so we understand that and can kind of feed into our decisions if there are certain economic, sectors that, are particularly important to your community, and really working with your industry and your businesses to make sure that everybody understands how to be safe, and make sure that they are, your businesses are, implementing practices that are safe, or as safe as can be, so that we can minimize transmission. I mean, the last thing I want to do is to just rebound and have to start all this over. And I know the governor does not want to do that as well. So sorry, I'm not sure I have better advice, but completely appreciate the balance and the challenges that you are encountering. We're thinking about the exact same things at the state level. How do we find that balance? What is that balance for our state?
Well, great. We thank you. Jamie, I don't know, from a time perspective, I see Kate Dean and Rick Hughes both have their hands up. I don't know if you want to go to them. We can just, I don't know what Dr. Lofi's time frame is as well. I'm more than happy to forego a roundtable if we want more questions here. It's up to you.
Yeah, they're happy. There was another question that came in too, and I know this is probably on lots of people's minds. Opportunities for variances to move to phase 3.
Yeah, and I'll be totally honest with you all. We haven't even really started to think too much about that, and what I've realized during this pandemic is we can kind of only just take one step at a time. And our next biggest, next biggest decision is about, the Stay Home, Stay Healthy order and the May 31st deadline, and figuring out kind of what the next steps are there. But I'm sure, after that, we will probably start thinking about the stage 3. I've kind of lost track of weeks. I do know that everybody needs to stay in a phase for at least 3 weeks. And I'm trying to think, it's probably been about 3 weeks now for some of the folks, some of the counties that entered phase 2 kind of immediately. So that will probably be the next consideration.
Great, thanks.
Please share anything that you all have learned for those of you guys have moved on to phase 2. If there are things that you're learning about your community, let us know.
Great. Councilmember Hughes, if you can unmute yourself, your hands up. And looks like you're still muted.
If he dialed in from another phone line, he should press *9 so we know what to unmute.
He says he's on Zoom. Let's see here.
Well, let's move on.
Here we go. Sorry, I got it. My apologies.
There he is.
Thank you very much for your time. And again, I'm not trying to create a rivalry between other counties on who you read first, but ours will be really good, just saying. One of the things that we've struggled with, San Juan County has, I think, the most restrictive rules in the state right now. We have a health order for a lodging ban. And once we kick into phase 2, we will have a mask order as well. So the concerns I had today as we were talking about moving to phase 2 with our public was that San Juan County is not allowing people to stay in our hotels, but it seems, according to our hotelers, that many other places around the state are allowing non-essential travel. And it's really hard for us to try to follow the non-essential travel ban to the letter if it seems like other vacation destinations around the state aren't. And is there any advice to San Juan County as we try to follow the governor's stay-in-place order to the best of our ability?
Yeah, to be honest, I would have to look back. I know we talked about essential, I think in phase 2, did we say something about limited travel around
It's
your
basically
household?
locals only.
Yeah,
So
I think we wanted the people not to be traveling across the state to sort of destination towns. I don't know how you feel about that. I mean, again, there's the balance between, your economic impacts and your, disease spread around the state by people, traveling all over and going to vacation spots.
I guess my question is, so we have a transient lodging ban. So
Okay,
it
that
is
the
against
health
the law in
officers
San Juan
then?
County to stay in a hotel.
Okay,
And it is tied to the governor's essential travel stay in place order.
okay,
And it seems like the letter of the law says you shouldn't travel more than your neighborhood. You shouldn't spend the night somewhere else. And we're having a hard time defending our order because we're hearing that many other vacation destinations around the state are allowing people to spend the night. So I was asking
okay.
for advice on how we enforce our order that is following the governor's order.
Right. I'll have to ask, I'd have to check in with the governor's office around what they're kind of telling people around that. I know they're taking lots of questions. Can we get back to you somehow?
Of course. Thank you very much.
Okay, Jamie, if you could maybe connect me with the commissioner, that would be great.
Absolutely. More questions are coming in. So Eric, if you're okay with kind of pushing back the roundtable a little bit, that would be great.
Yeah.
All right. Is it possible to add drive-in theaters to phase 2? Or those business sectors within those phases, are those a little bit malleable?
I think so. As you guys can imagine, there's an incredible number of businesses and types of activities that can be done. And clearly the one-page table was not able to sort of capture every possible situation. So I think that that's something that we could talk about from the public health perspective. I think drive-ins with your family member, I'm assuming this is a drive-in movie. I think that that would be very safe from the public health perspective. It's just not something that we thought about. I know we've allowed drive-in church services in phase 1. So I don't really see why scientifically we couldn't allow drive-in movies in phase 2. It's just not something that we even talked about that came up. So it's something we'd have to follow up with the governor's office on.
All right.
And I am writing all these questions down.
Great. State campgrounds reopening June 1st. Do you expect that to happen?
These are campgrounds for people. I thought state parks opened with the
They open for day use.
Day use. Okay, that's right. Campgrounds for overnight camping.
They have expressed the interest and have been asking counties what they thought. I don't think state parks has made a decision about that.
Okay, because I'm pretty sure for phase 2 in recreation, we allow camping and other outdoor activities. I believe that's in the table.
Yes, I think so. Another question.
Probably need to have campgrounds open if we were allowing camping.
Yeah. A question around the COVID activity measure. Is it equitable when applied to smaller counties by population? Some counties, because they're so small, one case in a 2-week period, keeps them over that 0.71.
Yeah, no, I get that. And that's one thing that's been really challenging about the metrics is that some metrics work good for some counties. They don't work great for other counties. For example, in the really large counties, I think, downward trends and hospitalizations and deaths, works pretty well because they have a lot of hospitalizations, unfortunately, when they have a lot of COVID activity because they have larger populations. That metric does not work very well for smaller counties because smaller counties will have just a few people hospitalized, which could represent, but you can't really see trends in that data. So I do think moving forward, we do need to think a little bit about, you know, having various metrics for various different sizes of counties. I think that's one thing that we've learned, and I think that the metrics will evolve over time as we kind of get more experience with the pandemic and learn more about, you know, the advantages and disadvantages of certain metrics in certain counties. So, right, really small ones, yeah, I know you can get 1 or 2 cases, and then your incidence through the roof.
Yeah.
Dr. Lofi, this is Eric again. Could you, I think there's still just a lot of confusion, and I'm not sure you're the right person to ask this question to, but because a number of our folks are asking about it, which is this magical belief that this 3-week component of what it takes to move between phases, or that there's going to be automatically everyone that's in phase 1 in 3 weeks are going to move to phase 2, which means phase 2 can move to phase 3. And that there's something that is firm about that 3-week date. Could you talk about that? Is it really a hard and fast date? Or I think there was at one point a conversation that I recall having with you and Secretary Weisman that no one would probably move to phase 3 until the entire state was in phase 2. So could you talk in general about what the progress that a jurisdiction would make in moving through the phases?
Sure. Well, let me first talk about the 3-week minimum. So the rationale for that is that the incubation period for COVID-19 is up to 14 days, and our data are not in real time. So it generally can take about a week, you know, after somebody gets sick, hopefully not a week, we're trying to shorten this, but after somebody gets sick and goes to the doctor and get tested and the test result gets back, I mean, that can take like a 4 to 5 day period. So the data we come in, so 5 days later, we're getting a report on somebody who got sick 5 days ago. And so there's this natural lag in the data. So the thinking around the 3 weeks is that we would wait 1 incubation period, and then we would account another week for a lag in the data to see if after the reopening there was, you know, a fair amount of transmission in that first generation of transmission. I think it's actually the very minimum. And so that was the rationale around it being 3 weeks. The plan does not really address anybody moving to, I don't think we have any criteria yet for people moving to phase 3. I don't think that we ever intended it to be automatic. In terms of, you know, once you got to phase 2, we're actually just working on thinking about how we might define a rebound now in cases to try to figure out if areas that are starting to open up are seeing rebounds in cases. And that's another sort of data issue we're working on. But as of right now, there's been no guidance around what will happen to those counties that have been in phase 2 for 3 weeks and haven't seen a rebound. I don't believe that there's any guidance currently saying that they can move on to phase 3 at this point, but I do think that it is an issue that we are going to be actively discussing soon, because we're going to have to, because I think people are probably about to hit their 3-week mark.
Great, thank you. And I think in the interest of time, we've got might have a couple more questions coming in, but we will get those to you. In the interest of time, I think we'd like to move on. But thank you, Dr. Lofi, very, very much for spending a good hour with us almost in answering questions and sharing information. We really appreciate it.
Yeah, no problem, anytime.
Yeah, thank you. All right, well, thanks. We are going to do a quick transition into a round table, but instead of just going through, because there's a lot of folks still on the line. In fact, I think we still have 53 attendees. So what I'd like to do is, if you have a specific, if you'd like to add something to the discussion live, if you would raise your hand. Not all counties need to speak, but if there's something you'd like to add, a question you'd like to pose into the chat box for your volunteers, feel free to do that. If there's something you'd like to share about what's going on in your county, please do that. Keep in mind, we've got two, actually, Jamie, why don't you just go ahead or Jason, move ahead to the slide that has our meetings on it that are upcoming. We've got a number of calls. Yeah, that's good. We have a number of calls and meetings coming up. You've all been a number of you have been invited to. We have a coronavirus funding call coming up. We have a variance work group coming up. And we have a budget workshop coming up. We've got a number of meetings that are forthcoming. I think the most of those, I think, are actually on Tuesday. So please just really understand that we really want these to be engaging conversations. So in those meetings in particular, we'll be having a little presentation, but for the most part, these will be dialogues for you to be able to exchange amongst yourself the struggles you're dealing with the budget. Those 22 counties that are now eligible for the variance, being able to talk amongst yourselves on the challenges and the governance issues that you're facing on the variance, and then the coronavirus relief funding as well. So we'll be doing a couple of different things coming up. So with that, I want to throw it open, and Jason or Jamie, if one of the two of you can help me look at our participant list to see who is might have their hand up to unmute. Commissioner Exner, Commissioner Price Johnson. So if you want to unmute Commissioner Exner, go ahead.
Yeah.
Commissioner, Commissioner Exner, you are unmuted on our line. So if you want to unmute yourself.
We got it now?
You're good.
Yep, go. They're good.
Okay, thank you. Thank you for putting the call together once again. I guess my question stems around the map that you just had a minute ago. If we have 8 out of 10 counties in our area that are interconnected and make a region, I don't quite understand why the state is not looking forward and having beginning to get in place regulations for our entire region to move forward into phase 3. We got the whole eastern side of Washington state that are all okay and in phase 2. And it's incredibly frustrating to hear that they don't even have a plan yet. So I'm not sure how that works into a question, more of a statement. We've got, we've worked really hard with our Tri-County Health District, our hospital, our health officer, and our counties to get, where we're at with this now, and to have that big of a region and not have the state be aware that it needs to move forward into phase 3 is, like I said, incredibly frustrating. So it can go from there. Thank you.
Thanks for your comment. I think if you look at the map, it's clearly a rural east with Spokane and a rural west, with some counties that are also fairly large with Clark, Thurston, Kitsap, a number of counties well over almost 300,000 and 500,000 people. So yeah, it's those are really good points. We have been asking about making sure they start to work on particularly the guidance associated with phase 3, so that when we get to phase 3, that you can act quickly when it's there. So we definitely will be relaying to that. I know we have a call with the governor's office on Tuesday morning. We'll start to push that conversation a little more directly. Commissioner Price Johnson, I think you had your hand raised.
Hear me?
Yes, we can.
Oh, great. Yeah, I wanted to share that we are looking at using our CARES funding in 2 distinct ways. One, to address behavioral health and essential needs. We put $1 million into a grant program to help support essential needs and housing, particularly rental assistance, and then also to redirect the folks that are being funded through our 1/10 into doing outreach with families that are vulnerable. I didn't know if anybody else was looking at that. And then the other piece is economic recovery. We're trying to figure out how to do some, take a portion of our CARES funds to do some direct assistance to some of our small businesses. And if I don't have to reinvent the wheel, I would love to see what other people are doing for applications and process. Thank you.
Yeah, great. Thank you. Appreciate that. Commissioner Dean, go ahead. And you are unmuted. Go ahead.
Okay, can you hear me all right?
We can. Thank you.
Great. Good afternoon, everyone. It sounds like Jefferson County was not alone in submitting our application for a variance today. So congratulations to the other counties who finished that. It was a very arduous process for us with a lot of input from other jurisdictions. So hallelujah, great Friday afternoon accomplishment. We did take a fairly regional approach. We have kind of a phased approach to our phase 2 and linking, for example, we linked the opening of camping with Clallam County. We will not allow camping until Clallam County does as well. And then we will not allow dine-in restaurants or in-store retail until both Clallam and Kitsap move to phase 2. So trying
Commissioner.
Yep.
Commissioner, does that affect Olympic National Park and Olympic National Forest as well?
So I have spent probably 8 hours doing a deep dive into camping and jurisdictions the last couple of days and learned an enormous amount. The governor's order did not cover federal lands, but the Olympic National Park and the Forest Service have been really strong partners in saying, we will follow your lead. So they're willing to work with us. But then, you know, we have county campgrounds, we have private campgrounds. There's a number of ways that those all interact with one another. That regional approach, I think, provides some sense that we are not going to be alone in kind of proximity to the I-5 urban area in terms of attracting tourists. So we're hoping that that modulates that a little bit. I learned something in this deep dive into camping that I think is worth mentioning. And, you know, we know things are changing very suddenly, but in a conversation with the governor's office today, it sounds like, and this came up because state parks initially said they would not open campgrounds until the entire state moved to phase 2. But it sounds like there's a easing off of that, that perhaps the whole state would move to phase 2 except the hotspot counties, which were identified as, you know, King, Pierce, Snohomish, and Yakima. And so it sounds like they're maybe considering the whole state except those going that direction for consideration. And so how that affects state parks is just that the whole, you know, the whole state doesn't have to go to phase 2, but state parks might be opening sooner than later their campgrounds here. So that's how that affected us. And I don't know if that's being applied to other policy decisions as well, but thought I would pass that along.
Okay, great. Thank you. Were there other hands up? I didn't see any quick, unless I missed them, Jason, or if you do have a question or you'd like to make a comment about what's going on in your county, please feel free to do that. I was monitoring hands. I don't know if there's any questions in the chat box or any comments, Jamie or Jason, that need to be read.
Commissioner Trask, a great question from Commissioner Price Johnson. They are also looking to use some of their CARE spending to help small businesses. Commissioner Johnson recommends not applying to phase 2 until you actually qualify. So just FYI. Commissioner Gelder wishes everybody a great weekend. He's got to leave. Question from Commissioner Skoog about history of communicable diseases spreading at campgrounds. Maybe I can circle back with DOH on.
Yeah, I do know. I don't know about communicable diseases, but I was a Lewis County Commissioner when we had a foodborne illness that hit a campground at Mount Rainier at Hanapakasha campground that sent a a bunch of kids that were there with the church group actually, and flooded the Morton Hospital because they didn't know what was going on. It's kind of funny, but not funny. So not about communicable disease, but foodborne illnesses, and I know hit them. Other questions? Look like there's a question. Is it true that in a previous meeting it was stated that groups of 2 or more would likely not be allowed prior to 1/1/21? There's a question. And I know I was not present during that call. I think Secretary Weissman said that it was, I'm not sure, Jamie, what the actual language was, but I think there's certainly, I know I've heard that there's some probability that it may or may not happen, but I haven't heard for sure.
Yeah, no decisions have been made on that. I think it was, best information and best guess and opinion, but really not providing an answer, yes or no, just kind of given the state of what things are and the current modeling. That was Secretary Weissman's opinion.
Okay, great. If I don't see if there's anyone, were there any other hands up, Jason or?
Commissioner St. Clair has her hand up.
Okay, go ahead, Commissioner St. Clair.
I put it into the chat box. An issue that's come up on my community is that we are not seeing our child care centers reopen because of the pretty strict protocols for child care centers around ratio and cleaning and so forth. So it's a question and a concern about our ability to support our workforce as they go back to work when we don't have necessarily childcare capacity in our communities.
Yeah, I know that has been a concern of when we've had communication with Chris Johnson from the Association of Washington Business, that the concern without K through 12 going on, without summer camps, without some of the other alternatives that have been in place potentially for childcare opportunities when, in addition to childcare facilities just not opening, that is creating, that's going to create a problem. I think that's a cognizant component. There was, I think the business community, I think, has actually identified that as an area of potential need to support small business and childcare in particular, so that they can be open to support business reopening.
Thank you.
Yep. Other questions? Commissioner Dean reminded us that, or let us know that they do have a drive-in theater in their phase 2 application, so they're keeping their fingers crossed for that. A couple other things in the chat box, you can all read those. So if there's nothing else, if there's no other hands up for questions or anyone that wants to chat, if there's no other hands up, let's go ahead and wrap it up. I think we are coming up and past the 4:30 time. So I just want to thank you all very much for the work that you all are doing, and really looking forward and hoping that you will in fact be able to assist or join and participate in a number of meetings that we have coming up next on Tuesday. So enjoy your weekend. In fact, Tuesday afternoon, we are going to be really, really busy. We hope that you'll be able to join us for the coronavirus relief funding discussion at noon on Tuesday. We have a county variance plan from those 22 counties moving from phase 1 to phase 2. Planned for 2:30 to 3:30, and then we have our county budgeting workshop from 4:30 to 6. In the county budgeting workshop, we have about 6 county budget directors, county administrators that were in their role during the Great Recession, and they will share some lessons learned from that period of time and things that you should be thinking about as you prepare to finish 2020 from both an expenditure and revenue side, and then how to be thinking about 2021 bringing those 2 years together. So hope you'll be able to join us for that as well. If there's nothing else, Jamie, if there's no other hands up, or Jason, if there's not, we thank you all very much for participating. Hope you have a very safe Memorial Day weekend and stay very, very healthy. And thank you again very much for the service that you are delivering to your communities. And we look forward to talking to you again on Tuesday. So have a great weekend. Thanks, everyone.
Bye, thank you.